Today on Diabetes 360, we're going to talk about community programs that are offered through Wellmont's Diabetes Treatment Center for our total region. The first is Safe Sharps. A lot of folks call and ask us, what do? I have to prick my finger 10 times a day to check my blood sugar. What do I do with that needle? What do I do with the syringes and the needles when I have to give myself insulin? What is the appropriate way to dispose of these? We can't answer that except, you put them in a container, it's a good solid container, you tape it, you put diabetes biohazard materials and try to get the trash dumps to accept them as the appropriate way, and often not, they won't. So what we have done, we have offered at any of the diabetes treatment centers with Wellmont, for that matter at any of the Wellmont locations, free Sharps containers. They're 1.5 quart, they're red, and if you will come in and pick one of those up, you can fill them up with your Sharps. And again, Sharps are syringes, needles, your lancets, your strips, all those things that have blood on them or that are sharp, you can put in those containers. Once they're full, you can bring them back to any Wellmont location. And on the screen, you're going to see the locations and a little bit about the Safe Sharps program. If you don't want to come by and get that, what we recommend is getting a heavy gain or a heavy detergent container and put your Sharps in that. Make sure when you put the top on it, you duct tape it, you put some label on it that says biohazard, and you try to dispose of this through the city in an appropriate fashion. But the easiest thing to do is come to these Wellmont locations, pick up your Sharps container, and bring it back when it's full, get you a new container. We used to do this, and we stopped the program several years ago, and we've just opened it up again for a 6-month period. So please take advantage of that. Now, one of the things that we see, we've talked a lot about type 2 diabetes, and with type 2 diabetes, as this is growing, 29 million in our country have it. In Tennessee, we're the 4th highest in the country, and in our state of Tennessee, we in Sullivan County have one of the highest in the state. So with more people having type 2 diabetes, you're going to see more individuals having diabetic conditions, diabetic events, being hypoglycemia, which is low blood sugar, or hyperglycemia, which is high blood sugar. A lot of these symptoms are fruity breath, dizziness, agitation, vomiting, nausea. Those things, those conditions mimic impaired driving, either by drugs or by alcohol. So keep that in mind and think, if I have a diabetic event and I'm in my home, yes, you need to get help immediately, but what's going to happen if you're out on the roadways? Well, a couple of things. One, you might have to pull over and you go into a coma. You might have an accident. You might have the police chasing you thinking this person, the erratic driving, is due to impaired driving of drugs or alcohol. So to counter that, what we've done is developed a sticker, and it's called the Diabetic Alert Window Sticker. And here's a brief 30-second clip to explain this program.
So, what's a window sticker have to do with diabetes? Tennessee law enforcement and emergency personnel have been trained to recognize this sticker to identify individuals who may be having a diabetic emergency. If you've been diagnosed with type 1 or type 2 diabetes, request a prescription for the Diabetes Alert sticker from your medical provider. For more information on this free alert program, call Wellmont Nurse Connection or visit mydiabetesalert.com.
Now, you can see what a window sticker has to do with diabetes. This was developed in order so law enforcement has what we call a timeout. In order to get that sticker, you have to go to your physician and get a script that we provide to all physicians locally that says you have diabetes. Once you get that prescription, you can bring it to any Wellmont location in Tennessee, or you can bring it to the diabetes treatment centers, and we will give you a Diabetic Alert window sticker. Now, the way this works, we work with law enforcement. They want to make sure that every individual that has this sticker actually has diabetes. We have trained law enforcement not only in our region and the Tri-Cities area, but across the state on the effects of hypo and hyperglycemia on the roadways. Matter of fact, 900 of our Tennessee highway patrolmen have a pocket sticker, which you're going to see on the screen in a minute, that depict what is hyperglycemia, what is hypoglycemia, the symptoms of that, and how to treat it. This is the sticker on the screen that will show our law enforcement what these conditions are. Now, we have trained all the local law enforcement personnel on this condition, on this program. When you get your sticker, you put it in the back rear window behind the driver's side so law enforcement have a clean shot when they go up to your vehicle. And it's not only protects you if you are in an accident. EMS will come and see that and go, this individual has diabetes, it could be related to that. But if you have something on the side of the road or if you get pulled over, law enforcement knows this person has diabetes, that might be the reason. So it's a safety factor for you, and it's a safety factor for law enforcement and EMS. I mentioned earlier about going across the state. This was the program that was developed at Wellmont, and we went to the state with this and got grant money in order to take this across the state. We've worked with the Tennessee Hospital Association and the Tennessee Safety Commission on taking this across the state to 27 hospitals. Started in the Tri-Cities, and we're now in Memphis as well. So that's another program that we offer, a community program that's absolutely free that we offer to our community. Another thing that we have done is we received a grant to go into the city schools in Kingsport, the 2 middle schools, with Nuval. What we did is went in and scored the lunchtime food and all the snacks with Nuval scores. We educated the students on what Nuval was, that you can see in all the Food City locations here, and we started tracking what the buying habits of the students were before they were educated on Nuval and after. And we saw an immediate shift in buying the lunch and the snacks to a more nutritious area. We brought families on board. 48 of the families participated with us in getting educated on Nuval and what it can do for you and your family. And we saw changes in the buying habits of those families before we educated them on Nuval at the city schools to after. So that's another program that we offered that was very, very, very well received in our community. We're hoping to get grants to take that out again. Another program that we're looking at, we highlighted in an earlier Diabetes 360 that there is a prevalence of type 2 diabetes in our adolescent population. If you think about that, it's very sad, but the earlier you can detect prediabetes and diabetes in our children, the earlier that we can condition them to take care of this diabetes, to embrace this diabetes, and control it for the future. So what we have done is gone into 2 of the schools in Bristol, Tennessee and Bristol, Virginia, and we have screened the children in a specific age range for diabetes. We did finger sticks, and if they achieved a blood sugar level of over 140, they were given an A1C. An A1C is something that tells you what your blood sugar is over a 3-month period. A1C diagnoses diabetes and prediabetes. If these children were diagnosed either prediabetes or diabetes, their parents were given the opportunity to put them into a free education program which taught behavior change, nutrition, exercise, and NuVal was part of it as well. The exercise component of this program was provided to us by the Bristol area YMCA. All this is things that Wellmont is doing not only to help our community, but to help the country when it comes to prevention and awareness of type 2 diabetes. I'm Jim Perkins with Wellmont, and this has been Diabetes 360.